Plastic surgery in Miami, Florida. You can come check us out at pureplasticsurgery.com. You can get all this educational content we do on a weekly basis, and you can see before and after pictures. And again, I'm Dr. Garrett Wegerif. I'm a double board certified plastic and reconstructive surgeon. And today we are going to be talking about the importance of pre-op and post-operative photos. We don't do that to make you feel uncomfortable. It's actually a really important part in any plastic surgery clinic for multiple different reasons, and we're going to kind of go through all those different reasons. So first of all, it's to document exactly what we're going to be addressing and changing, and be able to track over time how we were doing with that. And so that's really the most important thing. Surgeons were continuously modifying our techniques to get better each and every operation. And the way we're really able to track that is by looking at these preoperative and postoperative photos, because for plastic surgery, it really comes down to, especially for cosmetic plastic surgery, it comes down to the aesthetic results we're able to achieve. So whenever I do a slight modification of my technique, I really want to be able to track it over time so that it can better serve everybody as I continue to learn and evolve and improve my techniques over time. This is something common to any surgeon, and if any surgeon says they no longer need to improve their technique, you should probably start looking for a different surgeon, because you always want to be evolving and improving so that you're delivering better and better results each and every time. So that's the main, most important reason I would have to say, and the big reason for me. The other reasons you want to do it is because you want to be able to document your own journey. You want to be able to see where you came from, where you started. And it's important because sometimes people don't realize that they have certain asymmetries or certain things that were existing before surgery that, even though we pointed out and talked about it in the preoperative visit, you may not remember that. And we can go back to those photos and kind of look at things and see what we were able to change, so you can see that we actually did make an improvement, or we made a change, or that something was pre-existing, like your skeletal structure, that you had one hip that was higher than the other, or one shoulder that's always higher than the other, or the breast mound itself is positioned a little differently on the chest. And we can look at all those things and identify it and be able to see if there's some issue that needs a revision, or if that's just the underlying anatomy that you have. And then the final reason, and probably the reason you came to any surgeon you went, choose to go to in the future, is because it's for patient education and to help future patients make decisions about which surgeon they want to work with. So it's super important. I'm sure for all my previous patients, the reason they came to me is because of talking to other patients that had a good experience and looking at those before and after pictures. So it doesn't mean that every single patient I have agrees to or wants their photos shared with social media, but it's a really important thing for educating other patients and showing what's possible for all different body types, because I have patients of all different body types coming to me. We have massive weight loss patients, and we have super fit patients that are just coming for minor tweaks, and we want to show representations of all those different body types so that you can make a really informed decision about what you can expect from your results based off of other patients that have similar starting points to you, and where we're able to get them. So it's a hugely important thing that I appreciate all my patients, especially when they agree to share social media and those things, because it helps people make better decisions in the future, and it helps me educate people. So if you choose to do that, really important. We can always hide your identity, and we can always hide things like tattoos or piercings or any other things that might be able to identify you. But we also totally understand if you're just uncomfortable with the idea of your photos being on social media, then they don't need to be shared. But no matter what, if you're coming to this clinic, you're going to be getting preoperative and postoperative photos taken no matter what for our internal records, so we can kind of track the progress of your recovery. And so for my patients that live out of town, you're sometimes not coming for those later follow-up visits at 6 weeks or 3 months or 6 months or a year down the line. And I still really like to see those long-term results, because things continue to evolve. So it's really important when you're at home to take really good postoperative photos for me, so I can help establish if there's anything that we can be improving or changing. And then in the early postoperative period, it's super important, especially for things like breast surgery with implants, because sometimes there's things we need to do to help encourage implants to settle evenly. And we can only start those interventions or those interventions are only successful if we start them early. Things like breast massage or breast bands, or just identifying any issues with your recovery process. We really want to be able to see it and document it over time. And so that's why it's really important for my out-of-town patients to take really good standardized photos similar to the ones that we took here in the clinic, so we can really compare them side by side. So what that means is we want a nice clean background, so just a blank wall when you're taking the pictures. You want to use good lighting, a good camera, and really ideally you want to have someone else taking the pictures for you so you can stand in a standardized position that you were at during the clinic visit, so we can really compare those images, because if you're holding the camera yourself, we're never going to be able to see the right angles to make good judgments or adjustments on what we need to do. So with all that being said, the importance of pre-op and post-operative photos, kind of why we need them, why we ask for them, and why we really appreciate when you allow us to share those pictures on social media. Do we have any questions related to that, or anything to do with any plastic surgery question?
Usually, what's the time frame of sending photos?
Sending photos, so we take pre-operative photos at your pre-op appointment, we take post-op day 1 photos, we take post-op day 5 photos, and then we always want 6 weeks and 3 months. And that's kind of our standard that we want. But I love when we get longer term follow-up photos. So I love 6 month and 1 year follow-up photos. So post-op day 1, post-op day 5, 6 weeks, 3 months, 6 months, and 1 year is ideal for me. And so whenever you come back to visit us in the clinic, we always take updated photos because, again, we just like to track things over time.
Somebody said hello from Minnesota.
Hello.
What's your favorite workout?
My favorite workout, I do mostly weightlifting. I've been really trying hard to do more cardio for heart health reasons in recent weeks, but that's a new thing for me that I don't really enjoy.
Somebody goes, I had a liver transplant 9 years ago, and they say rejection meds killed kidney.
That's possible. The medications for transplants are very, they need to be very carefully monitored, but that is outside of my scope of practice, so I'm not going to advise you on that.
Okay, and 1 second, let me check over here. All right,
everybody, I appreciate you tuning in. Again, I'm Dr. Garrett Wegerif here in Miami, Florida at pureplasticsurgery.com. Come check us out. You can start the consultation process at our website. You can see other educational content. You can see some of those before and after pictures we were just talking about. And I hope to see you all soon. And I will see you next week for Thursday Thoughts.
Oh, one question.
One question.
Do you do drainless tummy tucks only?
No, I do drainless tummy tucks and traditional tummy tucks with drains. All right, Perfect. Bye everybody. Have a great day.